Good morning, everyone, and welcome to the launch of the 2020 Australian Mental Health Prize. I'm Buttrose, and I'm moderating this morning's event from my home in inner Sydney. I would like to acknowledge the Gadigal people of the Eora Nation, the traditional custodians of the land where I am today, and pay my respect to their elders past and present. I also acknowledge the traditional owners of the lands upon which each audience member is located. I have chaired the Australian Mental Health Prize Advisory Group since its inception in 2016, and UNSW Medicine, through the School of Psychiatry, has hosted this annual event. This is the first time we've had an online launch. UNSW Medicine values and undertakes research on mental health issues and works closely with mental health partner institutes, faculties, and individuals. Mental illness is something that can affect many people's lives, and it profoundly affects many lives of Australians. It can affect every person of a person's life, their ability to work, to connect, and to live a fulfilled and meaningful life. The summer bushfires and COVID-19 pandemic has impacted on Australians, especially younger Australians, many of whom are reporting increased feelings of anxiety. One of the advisory group members, Patrick McGorry, says that he expects to see an increase in mental illness among younger people as we go on. And our guest speaker will elaborate further on that this morning. One of the aims of the Australian Mental Health Prize is to reduce the stigma around mental illness. Stigma is a huge obstacle to recovery. It deters people from asking for help and getting the support and treatment that they need. We hope that the issues around mental health that the Australian Mental Health Prize brings to the command of the community will help reduce that stigma. There is some exciting work going on in Australia in the mental health area, much of it groundbreaking. And the Australian Mental Health Prize recognises Australians who have made outstanding contributions to either the promotion of mental health or the prevention and treatment of mental illness in areas such as advocacy, research, or service provision. Now, before I introduce our guest speaker, let me explain how this morning's launch will evolve. We want everyone watching to take part, and I invite you to submit questions in the Q&A panel at the right of your screen. You can post your question anonymously or add your name above your question. And at the end of his speech, our guest speaker will be joined by two panelists, and the three of them will answer your questions. I would now like to formally introduce our guest speaker. Richard Bryant, AC, is Scientia Professor of Psychology at the University of New South Wales and Director of the UNSW Traumatic Stress Clinic based at the university and Westmead Institute for Medical Research. He is also a Fellow of the Australian Academy of Science. To officially launch the 2020 Australian Mental Health Prize, please welcome Scientia Professor Richard Bryant.
Thanks, Ita. And I'd also like to welcome you all to this launch. I suppose you're all joining us from your living rooms, your kitchen tables, or your offices. It probably looks like I have a very grand living room where I'm standing. I confess I'm standing in a university theatre, so this is not my home. But I do want to emphasise that this is a different kind of environment we're in. We are all doing this virtually, and I guess this is the whole new world that we have learned to deal with. Now, I'm really happy to be here to launch the Mental Health Prize because I'm a great supporter of it. Over the last 5 years, it's given a lot of attention, a lot of recognition to people that have been working incredibly hard in the space of advocacy, prevention, and delivering mental health services to people who need them across Australia. We actually have a lot of awards for researchers, but I think what this prize does that others don't is it really gives a lot of recognition to the people who are at the front line, and we never can do that enough. I'm also pleased to be here because, being UNSW is heavily involved in the COVID-19 response, including the mental health response. And I think reflecting that, we have participation here from the faculties of science, medicine, and institutes such as the Black Dog Institute. Now, I've been asked to talk a bit about the mental health effects of COVID-19. And what I would like to do is talk a bit about what we're going through now, what we can expect to go through when the pandemic is over, and I guess most importantly, what do we do about the mental health issues that are going to arise? And I think it's useful to divide the talk into those sections, because when we talk about the mental health effects that we're going through now, we all know what it's like to be stressed at the moment. I've certainly been feeling it, and most people I know have been feeling it. Social isolation, suddenly having children at home, homeschooling, while at the same time juggling a job. The whole issues of panic buying and am I going to get enough supplies? It's easing now, but initially there was a real fear of infection and what's going to happen to me. And what's going on now still is what's happening to my elderly relatives or other people who are medically vulnerable. Now, most of the community, and it's unusual to say this, but most of the world is experiencing this level of stress to some level or other at the moment. Now, I really want to emphasise that what I'm talking about here is not a mental disorder. These are understandable stresses that are causing elevated levels of stress. And when I talk about stress, I am talking about increased levels of anxiety, some mood problems, sleep difficulties, worry, feeling irritable. Now, these are issues that we need to take seriously, and we all need to learn how to cope with them better. But they're not mental health issues in the sense of being a mental health disorder. But nonetheless, they are real, and they are affecting many, many people. And I think when we try to understand why are we reacting the way we are, it's not hard when we look at things like, let's just take social isolation, for example. We know from so much work that's been done over decades that one of the foundations for our emotional, psychological well-being is social connectedness. Being able to physically be with our loved ones, to be able to do the things that we want to do and get support from people, particularly at times of need, is pivotal to our psychological well-being. For many of us, that's been taken away. Yes, we can have phone calls, we can Facebook, we can do all sorts of other interactions, but is it really the same? And I think this has been a great, great challenge for many people. And just the stress of having children at home, and you have an employer who's still expecting you to work, you've still got to do your job, but you've got young children at home and you're meant to homeschool or you're meant to mind them when they're home from daycare. It might not sound much, but this is an enormous stressor that's putting strain on families, leading to a lot of conflict sometimes, and this is another ongoing thing that goes on day after day after day. Now, what do we do in situations like this to manage it? I think the first thing we need to understand is that we are in the midst of an unexpected event. Back in New Year, none of us expected to be here 4 months later. This is a very sudden experience that we have no preparation for, no training for. And I think we need to remind ourselves that this is a time-limited event. It will pass. And we need to learn the strategies to cope with those. And I'll come back to those in a few minutes. One of the things we have learnt, though, from previous pandemics, such as SARS, is that there are going to be a significant proportion of people who, when the pandemic really starts to ease off, they are going to have an ongoing mental health issue. And these are the people that many of us are particularly concerned about. We know that anxiety and depression are probably going to be the most common problems that are going to increase. Now, we know normally they are the most common mental disorders in the community, and they contribute enormously to our burden of disease. But we know from the work that was done after SARS and other pandemics that we know that anxiety and depression will increase, and to a lesser extent there will be increases in post-traumatic stress, substance abuse, suicide, and tragically, domestic violence and the downstream effects of domestic violence. We also know from previous events that these increases in mental disorders are probably going to be most in high-risk groups. Now, we know that health workers, for example, are one group who can be more high risk, particularly those that are working at the coalface with infected people in intensive care, dealing with people who are dying, or even those who are working in aged care, seeing people dying and having to deal with the families who are having to experience that stress. Now, we know that healthcare workers, after previous pandemics, their mental health issues do increase, and that comes from a range of issues, including fear of infecting their own family members. Another group that's particularly at risk are those that are admitted to hospital because they're infected, and particularly those that are in intensive care. Now, to be honest, Australia has got off reasonably lightly relative to many other countries around the world. America, UK, many European countries, they've had thousands and thousands of people admitted to intensive care and huge numbers not surviving. We still have our share of them. And often we forget what it's actually like for the patient and for the family member to go through that experience. For example, if you're in intensive care and you're intubated, the process essentially is that you are sedated, you need to be put to sleep so that they can go through the procedure. Now, what is normally happening is prior to that, you basically get to say goodbye to your family because you don't know whether you're going to wake up or not. And what's more, the family can't actually be with you for infection reasons. So very often it's just looking at them through a glass partition or even just a phone call. In projects I'm working on in Europe, where there are thousands of people in this situation, it is highly, highly traumatic because the patient doesn't know whether they're going to wake up, the family doesn't know whether they're going to see their family member again. Now remember, these are people who even a week earlier might not have been that sick. So this is likely to create a lot of post-traumatic stress, and already we're seeing in certain countries people who have been in intensive care and being followed up, they are displaying very high levels of post-traumatic stress that in all probability is going to need formal assistance. I think there are other groups that we need to be aware of. I think those that have pre-existing mental health issues, whenever there's a major stressor, they are likely to be at risk. And we should not forget those. And this includes people with severe mental illness. And on that note, we should also keep in mind that with COVID-19 going on, it puts an enormous strain on the health system in terms of emergency departments and hospital-wide, health system-wide processes. And what does that mean in terms of the services that are normally available to support those people who do have a mental health issue and rely on that support? But I think the other issue that we really need to be concerned about is the downstream effects of the virus. That is, to what extent is the economic downturn, the unemployment, the loss of income going to have? Now, we know that whenever there's huge economic downturn, that does create a lot of anxiety and depression and other mental health issues, and this will go on for years. Now, I don't know what the proportion of people will have mental health issues. Nobody does. Many people, some commentators in the media have been talking about a tsunami of mental health disorders coming out of COVID-19. I disagree with that. If we look at every event, every pandemic in history, most of us are resilient, and we do need to remember that. But it is fair to say that across the board, there will be increases and they will be long-lasting. Now, I don't want to sound too negative here because I think there's actually some good news coming out of this. What do we do about these mental health issues? Well, even at the moment, there is an abundance of material to help people about how they're dealing with the stress now. There are websites, there are apps, there are lots of services available to help people just deal with the current stresses of just being in isolation, being unemployed, etc. And one of the most reassuring things I'm finding in this pandemic is that compared to previous pandemics, previous disasters we've had, around the world, including Australia, there is enormous attention being given to mental health. This hasn't happened in years gone by. Our own government is allocating a lot of resources to services to help people with mental health issues. And this is a great thing, but the challenge for us is to work out what is the best way to help those who have mental health needs. Number one, we need to have interventions that are scalable. That is, we need to be able to develop programs that we can roll out to huge numbers of people who may not have a mental health disorder but have some level of psychological issue that could be helped if they were given certain strategies. And I know my team has been working with the World Health Organization to develop these sorts of programs. We've been doing it for several years. And it just teaches people very basic strategies, such as teaching people to access their social supports, to increase their positive activities, to be able to solve the problems that they can solve. These are very simple strategies that we can do. And there's a lot of resources online now teaching people how to do that. And I think in terms of people with the longer-term mental health issues, it's going to be important that we make the resources available to help people in the longer run. The people with anxiety and depression, post-traumatic stress, the increased suicidal risk, and those with pre-existing conditions, and also those who are unemployed. I know the government is making a lot of resources available now, but I think a lot of us would be very reassured if we thought these resources were going to be made available in the long term. And I think one of the great learnings for us as a mental health industry, if you like, from all this, is how do we start to deliver our mental health services differently? Of course, we've all had to move to an online world, just like we are now. And psychiatrists, psychologists, counsellors of all ilk have been doing this online for the last few months. And I think we've learned that we can actually deliver a lot of effective mental health strategies to people in ways that don't require the traditional rocking up to a clinic attendance. And one of the interesting things about this is that I think a lot of people might start to access mental health services who never have before. Because one of the interesting things about COVID-19 is that I think the mental health issues will start to affect people who did not have mental health issues before, who aren't used to going and seeing a psychologist or a counsellor. So what can they do? Well, maybe doing it online. And when I say online, I mean telehealth, Zoom, Teams. There's lots of platforms now that are adapting for this sort of delivery, but also app and other digital platforms to help deliver services. We're only at the beginning of trying to understand how to deliver these services best. But I think one of the potential positives to come out of all of this is that we can do this better, and maybe we can help more people moving forward. Thank you, and back to you, Ita.
Thank you very much, Professor Bryant. I mean, just listening to you, my feeling about social isolation is that nobody hugs me. It's the human touch I think I miss. I can put up with everything else, but human touch I think is really important. Anyway, I'll leave that thought with you. It's time to introduce our other panelists this morning. Associate Professor Samuel Harvey, who leads the Workplace Mental Health Research Program at the Black Dog Institute. A psychiatrist and epidemiologist, he has a particular interest in the overlap between mental health, physical health, and work. Welcome to you, Professor Harvey. And Dr. Jill Newby, the Associate Professor of Psychology at UNSW, based at the Black Dog Institute. Her current research interests include technology-based interventions for depression and anxiety, including internet, e-mental health interventions, cognitive behavioural therapy, and mindfulness-based interventions, health anxiety and cyberchondria, and anxiety disorders and specific phobia. So welcome to you too, Dr. Newby.
Thank you.
Now, the first question I think for you, Professor Bryant, is what are the warning signs we should look out for as people are struggling with their mental health?
That's a great question, because I think often when we read reports or the media, we often hear the terms anxiety and depression bandied around, and often people don't know what that means. And I think what's a lot more meaningful is when we talk about the notion that I'm just not sleeping like I normally would. I'm worrying far too much, and I can't stop that worry. These repetitive thoughts are just going through my mind all the time. Maybe I'm getting really irritable. Maybe I'm just losing my temper more often at my partner or my kids. Maybe I'm drinking more than I should, or drinking more than I used to. And I think these are the more down-to-earth signs that we can often see in ourselves, but very often we don't see it in ourselves. And I think very often people who are with us, particularly in our families or our homes, they can see it. And often it's useful if we can point things out and say, how are you travelling with this? And I think it's those sort of common, everyday sort of reactions we need to be looking for as warning signs.
A question that I think I might ask all three of you to comment on. What do you think is one specific pervasive mental health challenge that the Australian Mental Health Prize is looking to highlight that's present at the moment? And do you think there is any opportunity for mental health and well-being that will come out of this time? Would you like to start there, Dr. Newby?
Sure. So one of the most common mental health conditions that we're seeing at the moment is anxiety and stress. So I think that would be one thing to highlight. And the second thing is around creativity. We've seen a massive change very rapidly in the way that we're delivering services and mental health services to people in need. And I'm really excited by that, to see what innovations are going to be developed and delivered over the next few months and into the next few years.
Professor Harvey?
Yeah, I think, and it was alluded to by Richard in his conversation, I think where we're going to end up seeing the biggest mental health impact of COVID-19 is in those longer term impacts that we have on, for example, unemployment or underemployment. So I think one of the themes that is going to come out of this is around reminding us of those social determinants of mental health, and that actually when we as a society think about what we need to do to improve mental health, it's not just about mental health awareness and mental health services. They're incredibly important, but actually it's about making sure that we find the right way to treat people who lose their job and those sort of more what we might traditionally consider to be sort of purely economic things, that actually we begin to be able to measure the tangible impact that they're having on some of these mental health outcomes. And
do you have something to add there, Professor Bryant?
No, I'd agree with both Sam and Jill on that. And just to reiterate, what we know from previous big events, there's a lot of resources put into the following year, but we know that economies aren't turned around quickly, and the downturn in the economy will go for years, and we tend to forget the downstream effects. So if there's unemployment or underemployment, this can often lead to a lot of side issues. There can be overcrowding, that can lead to greater domestic violence, that can lead to greater substance abuse, children get neglected. Let's remember that we have a lot of good evidence that every time a family is affected, or that a father or a mother is affected, that's going to have a direct downstream effect on the child or the children. And so we're talking about the next generation as well. And so I can't stress enough that I think looking out for the next number of years in terms of how we sort of manage people who are probably the most high-risk group, I think, is going to be those who are suffering from a lack of job security. Helping them is actually not going to just help them, but it's going to help a whole lot of people in their network.
If I just touch on the issue of children, to you, Dr. Newby, we know that children bottle things up, they observe things. I mean, we know, I mean, my own grandchildren asked if I was going to be all right. Before we had coronavirus, we had the summer bushfires. And I remember one parent saying, how do you explain to your children that morning is dark because the fires had made the sun disappear? I mean, these do impact on children, but do people really understand that, or do we tend to think, oh, the kids will be okay?
No, I think people are getting a greater recognition that their kids are noticing this. And like you said with the bushfires, there's a very obvious and visible reminder about the threat. This is more invisible. So it's a bit harder to put your finger on because you can't see the virus, but you can see media reports and you can see your family members looking worried and anxious. So I think there is a greater recognition about the impacts on children's mental health, especially as they're being schooled from home and their whole lives are being turned upside down like they have for adults. And this is where mental health research is really important, to understand the impacts on children's mental health and to work on interventions or resources that can help improve that.
But do children react the same way as adults, Sam or Richard? Do they react the same way? I mean, they don't go off on a drinking binge. They don't suddenly take substance abuse. They might get angry. They might throw a tantrum. But are there other signs to look for in children?
Well, there's probably two different types of ways they can react, and they're not mutually exclusive, but they can either what we call externalise, which would be acting out, getting aggressive, losing their temper more often, smashing things, or internalise, which is where they just get very scared and very anxious or withdrawn. We do know that some of the biggest determinants of that is just how the parent is behaving. Because children get a lot of their information from their parents. They get a lot of their sense that the world is okay, that I'm okay and it's going to be okay tomorrow. They get a lot of that from their parents. And so it's important that parents are able to communicate a sense that, we'll be okay as a family unit tomorrow. And I think in the current context of COVID, that's a very sensible, reasonable thing for parents to be communicating, that this will pass, that you'll be able to go back to school, that you can play with your friends and we can get back to normal soon. And in the meantime, let's keep a routine going. That's really important. Let's keep doing fun things. But let's limit how much of the gloom and doom, and particularly the negative media, that we allow children to process, because we know children cannot process this sort of information like adults. Cognitively, they're not able to because of their developmental stage. So we can look at something on the news and we can see something of a hospital ward or intensive care. We might think, well, yes, that's what it is. We've been into hospitals, but for a young child, that could be something from a science fiction movie. And so parents need to be able to explain things and reassure them.
Thank you very much. There's a question. Yes, Sam.
Oh, sorry, Ida. The only thing I think, I would agree with all of that. The one thing I would add is I think one of the things that COVID is going to do, and where we might see it most is amongst kids, is I think it's going to really amplify some of the social differences that we see. So if you've got kids that are part of a family where parents have a nice house and lots of computers, then, homeschooling works okay for them. Where you've got a kid that was already in a slightly precarious situation, and their parents are losing their work and they don't have the IT technology at home, I think we're going to see there was already a split there, and I think that's going to be amplified even more. And so I think the things that were meant to be being done in society to try and lift up those kids in those situations are going to need to be increased more if we're going to limit the longer term fallout from this.
Okay, thank you very much. Now, here's a question from a mental health practitioner. And it says, I've noticed that at the moment there are many people giving webinars and speaking about issues around mental health who don't have mental health training. How can we encourage the general public to engage with mental health and well-being without stepping into the space of an expert where the training isn't there? And it goes on. This is quite a long question. Some of the Australian Mental Health Prize nominees and winners are lay people who are doing incredible things for the mental health and well-being of Australians. So clearly those beyond mental health practitioners can contribute. But how can this contribution best be balanced? Would you like to have a go at that one, Sam?
It's a long but I think a really important question. And I think one of the stage we're up to at the moment with mental health is that we've got to the point that we're encouraging people to talk about mental health more, and lots of conversations are infused with mental health. And in general, that's a great thing. But I think there is a risk that somewhere along the way, we end up getting the message slightly wrong. And what's intended as a message to try and make sure people know it's okay to ask for help ends up being a message that you're all doomed and 50% of you are going to have a mental health problem, and really chips away at that sense of resilience and being able to cope that Richard spoke of. So I do think there's two challenges here. One is, how do we keep the conversation about mental health going, but with a positive message around how most people will be able to cope, and about reinforcing the things that they can be doing to cope. But then secondly, also making sure that for people who are struggling, there are trusted resources that they can go to. And I think one of the key things that we can try and make sure is there's a limited number of trusted places that people can go for that information. And I think we're getting to that point where we have a smaller number of websites and other information that people can go to and can trust. And that makes it easier for people to go out and have these discussions, because they've got that fallback position to well, if you're really worried, then here's where you can go.
You mean a bit like RSPCA approved, tick?
Yeah, I mean, I think, yes, in terms of having some names that people trust, and that you can rely on that information. And I think it is a very crowded place at the moment when you go and start looking about mental health online or in the media, and it becomes very hard to know who to listen to.
All right, there's one here. Free apps like Be a Looper have a long history of helping people connect and check in each day with trusted allies. Is the government, and also are your collaborators, looking at these? Would that be you, Jill? Could you answer that one?
Sure, I actually haven't heard of that app, but there are a range of different mental health apps and different ways to connect or check in with people, or teach people how to check in with others that they're concerned about, particularly if they're concerned about risk of harm. We are all looking at different ways of helping support people in the community through apps or telehealth or digital service providers. So definitely we are looking at that.
For you, Richard, I'm interested in challenges for doctors, psychologists to be able to connect with patients via screens instead of face-to-face, the lack of connection.
That's a great question, and it's one that's being asked on both sides, by both the clinician and also by the patients. Obviously, I think it's a trade-off. I think on the one hand, we don't have to be honest, it's what you said earlier, Ita, we don't have the immediate physical proximity of like being in a room with somebody. Instead, it's very, very different. You know, you're behind a camera. And that does create a sense of difference. Now, I've been wondering a lot about this, and to what extent is this a barrier, or is this just something that we just need to take time to adjust to? It may be that we can achieve and learn to get a very good sense of attachment and security with another human being via a different mode, but we've always done it physically, and so that's what we expect. It may be that we just need to do it differently. I think there's always going to be the need for the face-to-face. There's no doubt about that. But I think there's also great advantages in telehealth, because we know that most people with mental health issues don't go to clinics. And so if we can actually reach out to a lot of people and they're more comfortable with this format, then that's also a great thing. I think one of the as I said, the positives coming out of this, and I still think we need a lot of research to do about this, and I'm hoping that we don't forget to do the research, because now is a great opportunity to do it. We need to learn how best to deliver telehealth to people in a way that it's good for the clinician and it's good for the patient. There's a lot we don't know, and to be honest, we're all juggling a lot on opinion and feeling and feedback at the moment. But we need research to work out how to do it better, because this just isn't relevant to pandemics. This is relevant to remote Australia, and also to people who are just reluctant to go to a mainstream service.
That's and we have, so at the Black Dog, all of our clinics are now being done online, and I think you know, there are some good news stories from that. The other week, I saw a farmer who sort of said to me, who was out in Western New South Wales, and he said that he was so excited when he found out that this was an option because it meant he didn't have to take 2 days away from his property to come and see me in Sydney. So it's opening up some real opportunities. But then again, we are definitely having some people who are saying, no, I want to see someone face to face. So my hope is at the end of this, we will come out with a much more blended system. But I echo Richard's point about the research, because I think one of the mistakes we sometimes do in medicine with new technology is that we just try and replicate what we were doing face to face via a different medium. You know, when we first developed online programs, we tried to replicate that someone needed to do that for 1 hour every week because that's how we used to see people face to face, whereas actually, you know, communication through technology is totally different. And so I think one of the things we will end up learning is how to do telepsychiatry and telepsychology in a different way to how we do face-to-face medicine.
Do you have something to add, Jill?
No, I think I agree with everything that they have said. You know, it's an exciting opportunity, I think, to see where this space is going and to see what can work best for the patient and for that individual who's experiencing mental health issues. We've done a lot of work at St Vincent's and UNSW on telephone therapy and supporting people through online programs, and we've noticed a range of benefits that people can experience, including that sense of convenience. If they're too unwell to get out of bed, then they can call their practitioner. All of those things, including lost time and also the money that they have to pay to go to a clinician, can be saved from using online resources.
Okay, moving along. This is for all of you. What are the best coping tools, particularly for those who are feeling isolated? I'll start with you, Sam.
I think, you know, one of the in terms of the broader population that we're looking at in the COVID situations, we're really hearing three things coming through sort of both our online and our face-to-face clinics. The issue of social isolation, the issue of people just being worried about their health and the consequences of this, and also then thirdly, it exacerbating an underlying mental health condition. And actually what you need to do probably depends a bit on which categories of those you fall into. If you feel the prominent issue for you is one of loneliness and social isolation, then you know, in a way, the solution to that is reasonably obvious. It's about how can you reach out and connect with people, and of course, the challenge at the moment is how can you do that without meeting people face to face. And you know, for some people that's easy because they can do Zoom or Skype conversations with family and friends. If you don't have that technology in your house, then that makes it much harder, and you probably have to go back to calling people. But I think part of what you have to do is to not think that you necessarily have to have a reason to call people, to understand that part of the human condition is about interacting with other people, and don't feel guilty about picking up the phone and speaking to someone because they were probably looking for somebody to speak to as well. If your issue is more around health anxiety, then there are separate things that you can do in terms of trying to manage that anxiety. And perhaps I might sort of hand over to Jill to talk about some of the things that she's been developing to try and help people in those situations.
Right, Jill?
Sure. I mean, another thing, I would talk about health anxiety in a sec, but another thing we can do around loneliness and social isolation is I know a lot of people have trouble reaching out to other people if they're feeling lonely, or even saying that they're feeling lonely. So we as a community and looking in for our neighbours or family or friends or people who we know might tend to feel a bit more lonely during this time, and reach out to them as a way to helping others. And that can also help our own mental health. So in terms of the health anxiety question, there are a range of things that people can do to help with health anxiety. There are a few free online programs and resources that people can work through to develop skills to manage health anxiety. We are seeing increased rates of health anxiety at the moment, and that's not surprising because it's totally understandable to be worried about COVID-19. The fears are for the self, so some people are afraid of catching it themselves, and then others are much more worried about spreading it to their family members or their loved ones. So even simple things like cutting down the time that you're spending on Dr. Google or reducing the amount of time you're checking or monitoring or being vigilant to your body symptoms, and reducing the amount of media exposure as well. Watching those doom and gloom stories can be helpful.
And Jill, is it worth saying we've tried to pull together a collection of some of those free resources for people on the Black Dog website. So if they go to the website, there's a big banner there around COVID-19 related resources, and lots of the free ones are there.
Yeah, and so they include things like managing COVID-19 fears, how to get a better night's sleep during coronavirus. We know a lot of people are struggling with their sleep at the moment, particularly if they're feeling anxious, but also how to juggle working from home and how to create routines and protect your mental health as you're adjusting to working from home. So all of those resources and others are there to sort of bring out the top tips that we as mental health practitioners know from the research works to help manage this anxiety and these mental health concerns.
Thank you. And Richard, do you have some thoughts here?
Probably the only other one I would mention is that I think as we go now and into the future where people are dealing with unemployment and underemployment, that creates just a lot of real problems. And I think teaching people some basic strategies in problem solving, which at times like this we often forget about, to work out what problems do I have control over, what ones don't I have control over, and the ones that are somewhat controllable, what are the steps I can go through to actually control them and solve them? Because we do know that the more people can do that and even have a sense that they have some mastery over what they can do, that's hugely beneficial for their mental health.
Well, given what you've all just said, there's a question here. What if you live alone, you have no family or friends contact? Richard.
So if I'm alone, and I didn't mention this in my talk, and it was remiss of me, I should have, but I think one of the high-risk groups are the elderly. There's a lot of elderly people who are, during COVID, isolated, who rely on that interpersonal contact, and that's been taken away from them. And they're not tech savvy. And the idea that they can just get onto Zoom and have a chat with someone, it's not going to happen. And we know they're doing it tough. And I think for people like that, it's being able to overcome barriers so they can access services like even by telephone, and being able to connect them somehow. Now, in Australia, social distancing is easing, so hopefully we can get things back a bit to normal. But let's say that it wasn't. I think it would then be necessary to even make sure that people who are stuck alone, that they're even telephoning people, 3 times a day. And in that telephone call, they're not just rehashing, COVID gloom and doom and the possibility of infection and dying, but it's actually quality time and actually, having good quality social interactions with each other. That alone would do an enormous amount. So people don't feel alone. There's actually a world out there they connect with.
Somebody.
I apologise, Archer. I was just going to add, I noticed one of the other questions that scrolled by on the screen was sort of, and there's a lot of questions and they're great, but one was around this issue of CBT, and is this a case of yet again, no matter what the question is, the answer is CBT, seemed to be the implication of the question that was being asked. And I think one of the important things to pull out of some of the stuff that Richard and Jill were saying is that actually a lot of the evidence around what's going to work in terms of reducing the anxiety and distress around COVID isn't CBT. It's about some of those more practical strategies that Richard was talking about around problem solving, around social connectedness, around behavioural activation. So I think, and I'm aware we've got an audience that's a mixture of their level of involvement in the mental health sector, but I think the tools that are being developed are not all just CBT tools. There's a real mixture of interventions being developed.
Fine. Well, here's one here that's referring back to the bushfires. Have the mental needs of firefighters been overshadowed now by the pandemic? What do you think? Jill?
I think Sam might be better placed to answer that because he's been working with firefighters, and so has Richard.
Sam?
Yeah, no, look, it's an interesting question, isn't it? That 3 months ago, our days were filled up with meetings about how to support the firefighters and the communities affected by bushfires, and then in the blink of an eye, they're totally different discussions we're having. What I would say, though, from my point of view, there's a lot of the things that were put in place around trying to support those bushfire affected communities and firefighters that are still happening. They may not be getting the media discussion and the public discussion, but they are still being developed in the background. And those of us who are involved in supporting those first responder communities, we're sort of in that for the long haul. One of the interesting things about this is that some of the things that we have developed for first responders and for trying to support first responders in handling traumatic situations, they're some of the tools that we are now trying to modify to be able to be used by healthcare workers who are now facing similarly traumatic situations. So I think in a way this crisis has shown us just how important that ongoing research with first responders is, and so no, it's continuing.
I would back that up by saying that I think it's been a double whammy, beyond the firefighters. But if we think about a lot of the communities that were affected by the fires, I know for a fact they were desperately looking forward to Easter and the Easter break as a way of getting more economies into their communities, getting the tourists back. And then, of course, that's when the COVID hit and nobody was allowed to travel. And so economically, those communities are now going to be suffering even further in the long run, initially for because of the fires, and now because of COVID. And so, again, we need to pay particular attention to them because they are going to be, in the long term, doubly hurt.
Well, you'd almost be feeling despair, wouldn't you?
Well, again, it's about, and I think this is where the government, one of the best mental health interventions it did after the fires for those communities, it invested an awful lot of money into tourism, into those areas. And that, in a sense, was probably the best mental health intervention it could do, because it would get people down there spending money, and that would ease the burden of the families because they'd actually be getting back to their normal routines and earning money again.
Well, it seems a bit far off at the moment. In the current response and future recovery from the pandemic, how can we value and employ more and more people with lived experience of mental health issues and mental illness, especially those who are trained up as mental health peer workers under the National Vocational Training System of the Certificate 4 in Mental Health Peer Work? Who'd like to have a go at that one? Sam?
Sorry. Yeah, no, I can answer that. I think it's an interesting point. I mean, I think one of the things that a number of us are advocating is that given the longer term mental health impacts that Richard outlined, what is needed is not just the initial acute responses that are appropriately being put in place now, but we need to boost the established mental health services so that they are there to support people over the years to come. And when we look at what those mental health services need to include, obviously they need to include clinicians, but the idea of a mental health peer workforce being integrated with the community mental health teams out there is, absolutely what we need. We know that it's a really useful part of having an holistic service. And I think the way to try and get that integrated is to keep making the argument that we need mental health services to be adequately resourced, and this current crisis just makes that even clearer than it was before.
Here's a question that I think is your area, Jill. Are there any positive mental health and wellbeing consequences of the current COVID-19 crisis? Examples might be mindfulness, meditation, community spirit, and so on.
Yeah, so we've done a survey that we launched just after the start of the lockdown. So at the acute time when people were feeling particularly distressed. And what we were looking at is the mental health impacts of COVID-19. But as part of that survey, we also asked people what sort of strategies were they using to keep themselves and their family mentally healthy during this time, but also are there any positives that have come out of this challenging time? We know not everyone has experienced positives, but some people have. And there were some really heartwarming responses from that survey. It's actually a really nice thing to read. Thousands of people writing about the great things that their family are doing, including talking talking to each other, connecting with their loved ones, exercising, taking things more slowly, doing those things at home to keep themselves mentally healthy. Whereas there's been some positives as well. So one thing that we've talked about so far is the sort of a sense of reduction in stigma. So mental health is a bigger part of the conversation, and particularly for the government response, which has been a great positive. But there's also other positives. So experiencing a greater sense of empathy for people who are in vulnerable situations, taking the pressure off and feeling a sense of more calm, because they're taking the pressure off and not going. They might be learning new skills like mindfulness, or they might be really enjoying a sense of greater creativity that this sort of change in situation has forced. So there are some positives coming out of it, and I think that we really need to look at those too.
But it's a time surely when people have been forced to slow down.
Yeah.
And actually think about how they're living and where they want to go. And
prioritise what's important. You know, I think when we rush around in really busy lives, it can be sort of hard to take stock. Whereas this has forced people to slow down and think about what do they value? Like, what is the most important? And that, for most people, is their health and family and loved ones and having a sense of purpose. And so those things they've been able to reprioritise. And some people are saying they're spending less, they're doing different things, they're changing their workplace or changing what they're doing and changing their mind about what they want their lives to look like because they've had that time to restock and reprioritise.
I saw that in the Northern Territory, the figures for COVID among Indigenous communities has remained low. There doesn't appear to be any case at the moment. But there is a question here, how can we support Indigenous communities to manage their mental health? Richard?
I'm always reluctant to answer this question being a white fella. I do a lot of work with Indigenous partners, and I always, to be honest, defer to them to answer that question. I have certainly been in discussions with them over the last few weeks about sort of what impact it's having and where things might be going. And to be honest, we had a lot of these after the bushfires as well. Look, in terms of how we assist them, all I can say is we need to listen. You know, it is not up for us to say to them this is how you should be coping. Indigenous Australians have their own means, their own traditions of coping with stress. Clearly something like COVID is a new one for them, in a sense. Bushfires certainly is not. But we need to listen, talk to them and listen and be guided by how they think their communities need to be managed.
We've come to the end of our time. I'd like to thank everyone for joining us this morning, especially our special guest speaker, Scientia Professor Richard Bryant, and our panellists, Associate Professor Samuel Harvey and Dr. Jill Newby, Associate Professor of Psychology at UNSW. Thank you all very much. You've answered the questions brilliantly, and I think you've provided a lot of information for the people that have joined us this morning. Thank you too to the UNSW Medicine for hosting this event and for the work the faculty does with their valued partners such as the Black Dog Institute and the Faculty of Science. And please don't forget, we want you all to consider nominating someone. We want health professionals and clinicians and the general public to nominate those people who are making a difference in the area of mental health. And nominations can be found on the Australian Mental Health Prize website. That's australianmentalhealthprize.org.au. Thank you again, everyone, for joining us this morning for the 2020 launch of the Australian Mental Health Prize, and stay safe.